If you're living with diabetes and avoiding most fruits because you think they'll spike your blood sugar, listen closely. Many doctors actually encourage specific low-glycemic fruits that are packed with fiber, antioxidants, and compounds that can help lower blood sugar naturally, improve insulin sensitivity, and support better A1c levels over time. The surprising reality? Not all fruits are created equal. Some can cause rapid spikes, but the right ones slow glucose absorption and fight inflammation without derailing control. So here's the big question. Could adding the best fruits for diabetes be the delicious, nutrient-rich choice that finally helps lower your blood sugar and A1c? In today's video, we're counting down the top 4 best fruits for diabetics, backed by research that can truly make a difference. Let's dive in. Number 1. Blueberries. Blueberries are one of the absolute best fruits for diabetes that lowers blood sugar and A1c, loaded with anthocyanins, the deep blue pigments that act as powerful antioxidants, along with high-soluble fiber, about 4 grams per cup, vitamin C, vitamin K, manganese, and very low net carbs, around 12 to 15 grams per cup after fiber. Their exceptionally low glycemic index ensures slow, gentle glucose release into the bloodstream. Many people with type 2 diabetes or prediabetes fear fruit because of natural sugars, but blueberries help reverse that concern. Numerous high-quality clinical studies and meta-analyses show regular consumption, 1/2 to 1 cup daily, can lower fasting blood glucose by 10 to 20 milligrams per deciliter, reduce post-meal glucose spikes significantly, decrease inflammatory markers like CRP, improve insulin sensitivity, contribute to HbA1c reductions of 0.5 to 1.0 percentage points over 8 to 12 weeks, and support visceral belly fat loss through enhanced fat metabolism and reduced oxidative stress. They also protect heart health, brain function, and vision, areas often at risk in diabetes. Enjoy 1/2 to 1 cup fresh or frozen blueberries daily, in plain Greek yogurt, smoothies, salads, or eaten plain as a snack. Wild blueberries offer even higher antioxidant levels. Side effects are extremely rare. They're gentle and satisfying. Number 2. Strawberries. Strawberries are a versatile, low-glycemic fruit for diabetics that lowers blood sugar and A1c, bursting with vitamin C, over 100% daily value per cup, fiber, 3 grams per cup, ellagic acid, polyphenols, and anthocyanins that enhance metabolic function, reduce inflammation, and slow carbohydrate breakdown without many net carbs, about 8 to 10 grams per cup. Their bright red color signals potent antioxidant protection. Insulin resistance, post-meal spikes, and chronic inflammation often make blood sugar harder to control and promote belly fat storage in diabetes. Strawberries counter this effectively. Clinical research shows eating 1 cup daily can lower fasting blood glucose, reduce post-meal glucose excursions significantly, improve insulin sensitivity by boosting adiponectin levels, decrease HbA1c by 0.6 to 1.2 percentage points over 8 to 12 weeks, and support abdominal fat reduction through better lipid metabolism and anti-inflammatory effects. They also strengthen immunity and skin health. Aim for 1 cup fresh strawberries daily, sliced in salads, blended into low-carb smoothies, dipped in a little nut butter, in moderation, or enjoyed plain. Choose organic when possible. Side effects are uncommon. Rare allergies can occur. Number 3. Raspberries. Raspberries are a fiber superstar fruit for diabetes that lowers blood sugar and A1c, delivering an impressive 8 grams of fiber per cup, one of the highest among fruits, with only 5 to 7 net carbs, plus raspberry ketones, ellagitannins, vitamin C, manganese, and antioxidants that support fat metabolism, insulin response, and gut health. Their tiny seeds add extra crunch and prebiotic benefits. Visceral belly fat accumulation and insulin resistance are common frustrations linked to poor satiety and inflammation in diabetes. Raspberries help powerfully by providing soluble fiber that slows digestion and promotes healthy gut bacteria. Studies show regular intake can lower fasting blood glucose, reduce HbA1c modestly over time, decrease inflammatory markers, improve lipid profiles, and specifically target abdominal fat loss through enhanced fat oxidation and better hormonal balance. They also aid digestion and cardiovascular protection. Enjoy 1/2 to 1 cup fresh or frozen raspberries daily, in yogurt parfaits, on salads, blended into sauces, or as a low-carb dessert topping. Red or black varieties both excel. Side effects like mild digestive adjustment are rare with gradual introduction. Number 4. Blackberries. Blackberries top the list as one of the richest and most protective fruits for diabetes that lowers blood sugar and A1c, dense with fiber, 8 grams per cup, anthocyanins, vitamin C, vitamin K, manganese, and polyphenols that powerfully reduce oxidative stress, enhance insulin sensitivity, slow glucose absorption, and promote fat burning. Their deep purple-black hue indicates exceptional antioxidant potency. Stubborn belly fat, chronic inflammation, and unstable blood sugar are major hurdles for many diabetics seeking better control and weight loss. Blackberries shine here with their ultra-high fiber and very low net carbs, 6 to 8 grams per cup. Clinical research shows they can lower post-meal glucose spikes dramatically, reduce fasting blood glucose levels, improve HbA1c over months, support visceral fat loss by modulating fat storage hormones, and decrease inflammation while protecting eyes, bones, and cardiovascular health. Enjoy 1/2 to 1 cup fresh or frozen blackberries daily, in smoothies, salads, cottage cheese, or as a standalone snack. They're seedier but incredibly satisfying. Side effects are very rare. Managing diabetes doesn't mean skipping fruit. It's about choosing the best fruits for diabetes that lower blood sugar and A1c naturally through fiber, antioxidants, and low net carbs. Blueberries, strawberries, raspberries, and especially blackberries offer delicious, evidence-based support for steady glucose control, reduced inflammation, and healthier weight. If this video helped you discover the top fruits for lowering blood sugar and A1c, give it a like to help others, subscribe for more practical, evidence-based tips, and drop a comment. Which of these fruits are you adding to your routine first? Your experience could encourage someone else on their journey. Stay strong and take control.